Across the Fence, we'll get a glimpse at the technology involved in modern veterinary science and learn how vet professionals share their expertise with animal science students at the University of Vermont. Good afternoon and thanks for joining us. I'm Judy Simpson. Professionals around the state provide a variety of opportunities to college students. Businesses, large and small, offer internships, on-site experience, and professional mentoring. One example is Vermont Large Animal Clinic and Equine Hospital in Milton. The veterinary professionals there give generously of their time and expertise in support of students in the UVM Animal Science Department. To find out more, I'm joined by UVM's equine specialist, Betsy Green, and the owner of the Vermont Large Animal Clinic, Dr. Philip Ben Harveld. Welcome to both of you.
Thank you.
Betsy, let's start a little bit about talking about your department's relationship with Phil and his clinic.
Well, we've been working with them since they started the clinic back in 2001. We had a meeting in our department, my department chair's office, saying, okay, how can we get our students involved and get some experience? Because you think about it, most of our students come in and they want to be a vet. They need experience, they need the hands-on skills, but they also need to find out if this is truly what they think it's going to be, because it's a long run for undergrad through vet school.
And so, Phil, why is this important for your clinic to participate in this and have the students with you?
I think one of the big things is that we had a need for after-hours care for a lot of the in-house patients that we have. And we could have hired someone, or we could sort of have created this work with Betsy to make an opportunity for these students to get exposed to sort of the high-tech things that we have to do at the hospital, and also to understand what it really takes and how much work it is to be a horse vet.
Mm-hmm.
So we sort of brought those two worlds together. We do have a strong interest at the clinic in education. We train interns and externs, and we thought that would be a good niche for that.
Mm-hmm. And so, Betsy, tell us a little about some of the courses and labs and how the students have benefited.
Well, over the years, one of the favorite ones is the pre-purchase exam in my Intro to Equine Studies class, because I usually bring out one of our geriatric beginner horses with all kinds of lumps and bumps and say, okay, Dr. Phil, this is my $40,000 event horse and I want to do a pre-purchase exam. And of course, you know, you pick up the arthritic joint and he says, ouch. And it's a good example of talking about how the pre-purchase is just a photograph in that horse's history, and get the students to understand that. So whether they go in careers or just even have their own horse, they can understand the concepts. And they've also, Dr. Phil and his colleagues have done things in the equine lameness course for Jenny Wilkinson. They've done case studies, a little bit of everything to get our students experience and exposure to real life horse veterinary issues.
And I would imagine that's important for the students, not only to see if it's really what they want to do, but then also just as importantly to see, maybe this isn't for me.
No, that's true. We've had some come true that they said it was long hours, long time, and it's a lot of work, and they said that's not really what I thought it would be. It seems that there's a charming portion to the profession, but there's a lot of hard work in the background. So I think that exposure before you really go to a major school is important, I think. Yeah, we get to have one of those horses pass a pre-purchase exam on that course.
That's good. And so what are some of the examples of what you're talking about?
Well, just as one example, in the horse barn, we had a vet call and the horse had gotten away and actually hit by a car. And the owner of that horse went through from this horse might have to be put down or euthanized to healing, and then I think as a result of that, come into work in your clinic.
Yes, after we sort of went through the whole process of treating the horse, she got to see some of the behind the scenes and the opportunities there were with some of our colleagues that had worked with us, and she sort of applied for that position. So she's been working with us for several years, has done quite well, and actually applied to vet school this year and got into some of the major schools, and I think one of the offers was from Penn University, which is one of the top schools in the country. So
that's amazing. So here's someone who had an interest in horses but didn't realize that a veterinarian was the way to go.
Yes.
Well, and that horse she's still riding her horse.
That's great. So Phil, what are some of the things that are being used in Vermont today when diagnosing horses and, say, lameness?
I think that, you know, a big portion of the lameness workups is the diagnostic imaging. That is really the area that has really stepped up quite a bit.
So like x-rays?
X-rays and ultrasound. And those have been available for a period of time, but we sort of have migrated from the old X-ray cassettes that you have to take back to the clinic and go develop and go hang them up in front of a light, to having digital technology nowadays with the X-ray and with the ultrasound.
So what are we seeing here?
This is actually it was a tough case, but this is where the digital ultrasound, you take the x-rays and you see it right away in the field, and this, unfortunately, where you see those arrows is a fracture on a radius in a horse. So this was sort of a tough situation where we could tell the owner right away what was wrong with the horse.
And what about here?
That's the different
Same,
view.
different view?
Yes. So here we see a horse's head, and that's where digital x-rays have really come in as well. You can see where the arrows are is actually a cyst inside of a sinus of a horse, and you sort of see that straight line on the top showing that it's filled with fluid.
Oh, wow. And so in the past, you weren't able to do this. I mean, would the horse have to come to you, or would you have to take the images and then get back to the owner in days?
Yes, and what it used to be is you take the films, go back end of the day, process them, look at them, and then call the owner and say, this is what I see. Nowadays, the owner actually gets to look at the films with you, and it makes it a lot easier to explain that. And you can actually join diagnostics, and then because you have the results right away, treat the animal right away on the farm.
And so what are some of the newest technologies or techniques?
So
I think ultrasound's another one, though, that you've been using a
Yes.
lot at our barn, as far as the diagnostic, though.
Yes, we also, the digital ultrasound has, the level of quality has improved significantly. And as you can see there, you know, those are the different regions of the leg, and then you can get really high definition images nowadays to see if there's damages to ligaments and tendons.
And so looking there, I think that might even be one of our horses that has had
Yes.
some suspensory ligament issues, and you can just see what you see on the screen and then explain what it is to the folks watching.
So there, right there is the bottom portion is the suspensory ligament, and you see that darker area within that ligament, which is indicative that there is a lesion right there. And sort of knowing where that lesion is and the size will allow us to use more specific treatments and more advanced treatments to heal that horse and bring it back to work sooner.
And that's where some of the things that you've been doing more recently are really kind of cool, and really cool for the students to learn about as well.
Yeah, I think there's a gratifying part, you know, when nowadays when you do these images, you get the results and you see the screen right away. So that way, you know, people can see what you're doing and better understand their options for their horses as well.
I think, too, this is technology that you can bring to the farm.
Yes. Yes, it's something that instead of having to go somewhere or coming back with the results later, we can bring it to the farm and get everything done in a timely fashion.
I know we have some other things we're going to look at here, too.
So this is now we're moving sort of into treatment side of things. And there's much advances that we have right now. This is actually a processing of a product called IRAP, which is an interleukin-1 receptor antagonist protein. And interleukin-1 is the big inflammatory mediators in joints that causes pain and inflammation. And what we do is we collect a sample from the horse, process the blood of the own horse in a serum with those beads you can see in the syringe. And then we go back and re-inject it in the joint and sort of block the action of that inflammatory receptor, making the horses much more comfortable.
Wow. And that, once again, you can do it right there, and that is a big breakthrough.
Yes. And there's an example of that processed sample being injected back into a horse's joint.
Okay.
So kind of tricking the body into stopping overreacting to whatever is causing it pain.
Yes.
And now, what are we seeing here? Is that a similar procedure?
It's a little bit similar. The IRAP is sort of used to treat joints. On the tendon and ligament side, stem cells is the big therapy that we have nowadays. There's two sources of stem cells. One is sort of from the bone marrow of the bones, which is a common source. It's a little harder to get. But we also can obtain stem cells from platelets. So we can grab a blood sample from a horse and use a special spinner and filters and concentrate the level of platelets very high into serum. And those platelets also carry stem cell properties. And that is something that can be done locally. So we harvest the blood, process it, and then come back and inject it into that lesion like the one we saw in the ultrasound, and use those stem cells to sort of heal a better quality ligament or tendon at a much faster pace.
I think probably a lot of people watching this are amazed that this kind of technology is available for veterinary science.
Yeah, and in the barn. I mean, so that last picture was using the ultrasound to show exactly where you were injecting it, right?
Yes, so we use the original ultrasound image diagnosing the lesion, and then we can come back and use the ultrasound again to sort of put the needle right into the lesion. So instead of giving a big dose through the body, we can actually target the dosages right into the lesions themselves.
So before this technology was available, what would happen?
I think what would happen is that we would basically use anti-inflammatories, rest the horse, and bandage to keep the swelling down. But what do people want nowadays? They want the horse to be back sooner to riding, and they want the quality of the healing to be better. So instead of having excessive scar tissue heal the tendon lesion, we actually use the stem cells to make more original type cells to heal the lesion, which makes for a longer lasting healing process.
And tell me a little bit about how important this is, Betsy, for a horse owner, I mean, in some of the long-term problems that can develop with tendons and joints.
Well, once you have that injury, and it may be 6 months stall rest, sometimes it was up to a year stall rest for a bowed tendon and ligaments and things, and then the horse is not even close to guaranteed to be returning to the same level of activity. And so here you have these technologies where you can actually put the things, the medicine or the healing agent, directly where it needs to go, smaller quantities, less invasion of the horse's system, and have a faster, potentially faster recovery rate and better overall outcome as well.
And so obviously, too, probably in the long run, less expensive for the horse owner, too, to be able to have this quickly wrapped up as opposed to having to make multiple visits to the farm.
Yes.
Yeah, and if you look at it, when you say, okay, these technologies, they're not cheap.
Right.
But when you look at, okay, what does it cost to keep a horse on stall rest for a year and not have the use of him or have him even be able to go out and play and be a regular horse, whether shortening that and returning to better performance, it's definitely worth it.
I think the other thing with Vermont too, you know, because of the strong winters, the show season is short. So people sort of wait all winter to finally get to, you know, April, May and get going again. So if a horse has a lesion and you sort of take too long to heal, it'll be back in winter again. So people like the idea of what can I do to maximize what I can do, especially in show season.
Yeah, and there was one other thing that you've used on one of our horses, the shockwave.
Yeah, there's the other one. There's another technology that we have that is an energy probe that we saw in one of the pictures. And in also tendon and ligament injuries, we can use that shockwave treatment to make the horses quite a bit more comfortable. It's sort of a strong energy sense that sort of recruits the body to start healing that area faster. It's a non-invasive process. And also the shockwave will sort of demyelinate the outer layer of the nerve. So if you have a condition that is painful, it makes the horse quite a bit more comfortable. So sometimes like a ligament can be sore, you do an ultrasound and you don't see a big lesion. So structurally things are still okay, but just making the horse more comfortable with this therapy can get this horse going again.
Wow, and so obviously a great way for students to see firsthand these kinds of technologies.
Oh yeah, it's perfect example, and it helps our horses get back to work as well.
Yeah, and so let's talk a little bit about how maybe some folks can see these kinds of things in action.
Well, we actually have a demonstration at Everything Equine at the end of April where we will see some of these technologies put to work, and so that's just, it's really cool because we've done great things with Dr. Phil and his crew at Everything Equine, from endoscopy to now these techniques, and a chance to explain to folks what's happening and, you know, what they can potentially use for their horses down the road too.
Yeah, we will actually have a live demonstration at Everything Equine and Canine with Dr. Doolan, and she's actually going to show the digital ultrasound with a big monitor so people can actually see the structures, and then she will also follow that with the demo of the shockwave so people would have the exposure to see that.
And a great chance to ask questions too.
Yes, absolutely. Learn about it, ask anything they want to.
Yeah.
And so, Dr. Phil, if viewers want to contact your clinic, what's the best way to get in touch with you?
Oh, they can call us at 802-893-6800, and we also have a website which has information on it, which is www.vermontequine.com.
And Betsy, just before we go, we've got about a minute left. Still interest in veterinary medicine, still big interest in horses here in Vermont?
Very much so, yes. Everybody still comes in wanting to be a vet, and a lot of those folks find out that it still is what they want to do, and they are successful coming from our program, going all over the country and world to vet school.
All right, well, I want to thank you both for joining me today. That's our program for today. I'm Judy Simpson. We'll see you again next time on Across the Fence.